Thank you to Sinn Féin for bringing forward this motion, and it gives us an opportunity to discuss nursing home situation in the context of COVID-19. There's been much reference in recent months to the nursing home scandal which took place during our response to COVID-19. We heard the deaths referred to, and as stated previously by deputies, over 2,000 nursing home residents are considered in the COVID-19 death category, which is about 40% of all COVID-related deaths in Ireland. But we don't seem to have any specific details on what actually happened in the various different nursing home settings and how government policy may have played a role in making that problem worse. The motion calls for a full public inquiry into the nursing home deaths, and I'm sure when in contact with our constituents we all hear various different versions of similarly sad and heartbreaking stories of vulnerable people in our nursing homes. So we need answers. The stats and the stories indicate that there is a need for a full public inquiry. What really needs to be established is to what extent did the decisions of the authorities result in extra and avoidable COVID-related deaths? To what extent were nursing home patients denied treatment, which would have resulted in their recovery? To what extent were do not resuscitate orders used when nursing home residents were in hospital? We had reports over a year ago of patients being discharged from hospital with COVID back into their nursing homes, leading to major COVID outbreaks in nursing homes. Whilst we were conducting thousands of COVID tests per day on healthy people, the authorities didn't have a system in place to test vulnerable and unhealthy people before they were discharged from hospital and allowed back to their nursing home. All of the young, healthy people in this country were persuaded that they needed to remain locked up in their homes to protect the vulnerable. Meanwhile, it seems that the vulnerable were being neglected by the same people who were telling the young people they had a moral duty to stay at home. I'm concerned about the proposal in this motion to put visitation guidance on a statutory footing. It may be the case that in some areas that regulation of nursing home may be insufficient in some areas, but I would be fearful of what the visitation guidance referred to in the motion might look like when implemented. We do not want to create a scenario where a husband and wife, perhaps having their final embrace, are subject to a HIQA representative standing over them with a clipboard and a stopwatch, or where no exceptions can be made for individual cases. More fundamentally, do we really want this House to be deciding when a husband can visit his wife in a nursing home and under what conditions? Do we really want to be deciding to be dictating to a child when they can see their parent? I think making visitation guidelines into laws would be an overreach of the state, and I would have grave concerns about that. The motion also calls for the mandated reporting of abuse and neglect of residents by nursing home staff. It is actually very hard to understand how this is not already mandated. Regardless of whether this motion as a whole is passed or not, I hope that the Minister is listening and will take the necessary steps to introduce and mandate reporting of abuse and neglect without delay. Finally, the motion calls on accountability at organisational level. My experience as an elected politician shows that our attitude to accountability leaves a lot to be desired. So yes, I do believe that the motion is correct in calling for the introduction of accountability at an organisational level in terms of penalties and criminal offences where failures to govern safely in accordance with HIQA regulations results in the loss of health or life for residents in case of that service. But it is not only at an organisational level that such accountability should exist. Those making the policy decisions should also be accountable. I want to voice my utter dismay at the abandonment of nursing homes in relation to the temporary assistance payment scheme, and not extending it in line with the other supports says it all. Thank you.